Hi, my name is Ariana Little, and this is my Petcha Kutcha presentation. Today, we're going to talk about diversity in the workplace and how important it is when it comes to our patient care. Diversity in the workplace is important because we come in contact with so many different people from different races, cultures, religions, and so much more. Because we care for so many different people, the quality of care can suffer, especially when we are not knowledgeable about the different types of patients we are taking care of. As healthcare providers, we must realize that diversity goes beyond values and beliefs. It's also about languages, physical sizes, gender, sexual orientation, age, disabilities, both mentally and physically, social economic statuses, and etc. Not only do we have to be mindful of our patients, but we also have to remind ourselves when it comes to our coworkers as well, whether they are physicians, nursing assistants, environmental services, dietary, no matter who they are still people who are different than us, and we should recognize that. I'm going to define cultural knowledge. Cultural knowledge is a process of seeking and obtaining sound educational foundation in diverse cultural ethnic groups. It is paramount into taking care of our patients because this will help us to understand what is important to our patients, their way of thinking, and receiving information. A situation I have experienced in the past 2 years was when a patient was on their deathbed with only a few weeks left to live, and the patient's family was ready to have a conversation about the next steps and everything they needed help with. They asked the provider if it would be okay before the patient was activated that the patient's bed could be faced toward the sun because they are Muslim. Unfortunately, the provider rejected their request, showing unconscious incompetence, which is basically the doctor not being aware and lacking in the cultural knowledge that in order for this patient to, pass peacefully, this is what their family needed because this is just what they do. And what the doctor could have done was, said, let me get back to you. Let me do a little bit of research. Or even just granted their wishes. It would have taken nothing to just turn the bed and, let them be comfortable with whatever they needed to. In this instance, how everything proceeded was the respiratory therapist asked the family, like, what is it that I need to do to make you guys more comfortable? And all they said was just to move the bed to face the sun. And that's exactly what the respiratory therapist did. The respiratory therapist moved the bed. He also talked to the physician and said, like, it's not a hassle. It's no big deal. I want to treat these people, with some respect. I know we are different. I know that we have different beliefs, but it's literally nothing to just turn the bed and turn the vent and turn everything else that the patient had. The respiratory therapist was very open and receptive to having this difficult conversation with the family, especially after being told no already. But so how everything was supposed to go was the bed was supposed to be turned, and the patient, after the patient is extubated, the patient is covered with a white sheet, and they are just supposed to pass. Nobody of the opposite sex is to touch the patient. The family is to read something from the Quran, and they would just wait until the patient actually passes. Because the respiratory therapist went above and beyond to make sure that this family got what they needed, they demonstrated conscious competence, which is an act of learning about the patient's culture and providing culturally responsive interventions. As I stated before, it didn't take anything but to just turn the patient's bed and turn the pump toward the sun. It took 2 seconds, a couple of other hands, but everything happened the way it needed to happen. She gathered up the team of people that she needed to make the wishes of the family happen with no questions asked, even though the provider said no. We have to remember that even though these people were different than us, we can still treat them with respect as well as treat them how we would want our own family to be treated in a situation. I will say that the patient's family member was a little skeptical about the respiratory therapist even taking the steps to do it because she didn't want the respiratory therapist to get in trouble. But the respiratory therapist told her, like, look, I would want my family to, be treated in this same manner. So I'm going to do whatever I can, even if, that means there's something that can happen to me on the back end. So, and the mother of the patient was like ecstatic. Like, she gave the respiratory therapist a hug. She like even bought her like a little like thank you gift. It was nothing big, but it was just a thought, like, you went above and beyond for me and my family at this difficult time, so thank you. It literally takes nothing just to show somebody some respect and to let them know that you are there for them. That's what we're there for. It takes 2 seconds. Yeah, I'm sure the ICU was busy. And there were other things that needed to be done. But if you have a team of people, that's what we're there for. We're a team of people. So we have to allow our patients that and give them sometimes that extra little bit of time that they need. Is paramount that we do those things, just because if it was our family, we would want somebody to do the same thing. And to be quite honest, the situation could have gone a lot different. Like, had the respiratory therapist not did what took of all of 3 seconds just to turn the bed and to turn a few pumps, it could have been bad. It could have went really bad for the hospital, because it literally just took 3 seconds and a couple of other hands just to make that family happy and to give them that ending comfort that they needed for their family member. We just have to be mindful and remember to just respect patients and their families and their wishes, even though it may be different than ours.